Are you all confused with what is rheumatoid arthritis? What are the causes and how do we manage rheumatoid arthritis? I'm Dr. Ananta Subedi, your rheumatoid arthritis coach and a practicing rheumatologist here at Empower Arthritis and Rheumatology Centers. We have a special guest today, Dr. Girnita, who has several years of experience in managing rheumatoid arthritis. We'll be learning more from her expertise. Stick around. Welcome, Dr. Girnita.
Thank you so much for inviting me. It's a pleasure and an honor to be here.
I'm hoping to learn a lot from you as well as my audience who are suffering from mostly rheumatoid arthritis and many other autoimmune disease. So we'll be learning from your expertise on how you manage patients and also trying to make rheumatology simple so that everybody understands, particularly those who are suffering with all of these chronic conditions. So I'll start with the discussion on some of the basics on what is rheumatoid arthritis.
A lot of people will be confused about what is rheumatoid arthritis, so I'm glad that you asked these questions. Rheumatoid arthritis is an autoimmune disease. It's an inflammatory disease, and when it comes to joint pain, it can affect multiple joints at the same time, or it can affect joints at certain times. It can skip joints. So that's usually where I will start the discussion with patients. But what is specific for rheumatoid arthritis is that most of the time it will involve small joints of the hands, small joints of the feet, and it will involve them in a symmetric and bilateral pattern, meaning that if you have the joints of the hands affected, it's both hands affected at the same time. It's going to be usually the second row of joints or the third row of joints, or both wrists at the same time, or both elbows, both shoulders, or both knees, or both feet. So that's very specific for this disease. And it comes with a lot of pain, with swelling and morning stiffness. Most of the patients will have this feeling of getting stuck joints or very stiff joints in the morning, but as the day goes by, they start to move their hands and that swelling will go down, or that feeling of stiffness will go down.
Okay, excellent. So that's a very good summary of understanding of what is rheumatoid arthritis. Now, for those patients who have some joint pain here and there, how do they identify whether they need to be worried about rheumatoid arthritis? Can you tell us a little more about what are the early signs of rheumatoid arthritis?
There are many early signs, from something like fatigue. A lot of the patients will be fatigue or dryness in the eyes or dryness in the mouth. But when it comes to joint pain, most of them will have these symptoms started. It can start in a couple of days, it can start in a week, it can start in a month. They can develop gradually, or they can come and go in waves. So they will have some episodes of joint pain and swelling a couple of times a year in the beginning, and then it will become more frequent. The other early sign that I want to talk to people, it's a carpal tunnel syndrome. Carpal tunnel syndrome in both hands is something unusual. Most people that type a lot, they think it's related to typing, but usually carpal tunnel syndrome happens in one hand, the dominant hand, the one that you use the most, and not in both hands. And when you have carpal tunnel syndrome, you probably have this experience, but I have seen patients that they have seen PM&R doctors, hand surgeons, they got injections, they got surgeries, multiple surgeries for carpal tunnel. And when they exhaust that pathway, somebody at some point they think about, oh, maybe this is something autoimmune in nature, and then they think about rheumatoid arthritis. So those will be the early signs that people should pay attention. If they have it in their family, then they should even be more careful, because there is a genetic component there, and if you have a first degree or a second degree relative, then that will increase your risk to develop rheumatoid arthritis in your life.
Excellent. So you summarized very well some of the risk factor, and reflecting on my own personal experience on some of these patients who comes with this bilateral or both side carpal tunnel, and I'm glad I practice an area where the orthopedic surgeons are very smart. They even do some of the rheumatoid arthritis testing prior to coming to my practice. So they usually think of rheumatoid arthritis if they have this bilateral carpal tunnel. So if you have any bilateral carpal tunnel, always ask the question, what is the cause, right? And rheumatoid arthritis could be one of those causes for having bilateral carpal tunnel syndrome. And that was an excellent point. Now, you're talking about some of the risk factor. Can we help our audience learn a little more about what are the risk factors I need to look into, and what are the risk factors that I can minimize or modify? What are the risk factors you may not be able to modify?
When it comes to the risk of developing rheumatoid arthritis, I just mentioned the hereditary component. Rheumatoid arthritis is not a genetically transmitted disease, meaning that if you have it, doesn't mean that necessarily your kids will have it. But if you have that in the family, your mom, your sister, if you had your grandma with rheumatoid arthritis, then there is an increased risk. And that means that in certain conditions, like let's say you get a viral infection, you might smoke a lot. So smoking will increase definitely your risk to develop rheumatoid arthritis. If you eat very poorly, meaning that if you eat a lot of fast food, if you are under a lot of stress, that's also important, because I have seen many females that will come after having or dealing with PTSD, they can develop rheumatoid arthritis. Or if you have significant changes in your life that will put more stress on your body, on your immune system, that will increase your risk to develop this disease. There are many other risks, but I would like to point towards the most obvious one, the ones that you can actually modify, like the risk of smoking. So if you smoke a lot, then your risk will be increased. If you don't take care of your teeth, that's another important thing. People that have periodontal disease, then they can develop rheumatoid arthritis because they didn't take care of that. People that eat poorly, then if they change their lifestyle, then that will decrease the risk. People who are obese, that's something that I don't want to shame anyone, but people that gain a lot of weight, then they can develop rheumatoid arthritis. And as I said, stress. If you are unable to control the stress, you should ask for some help, because the ongoing chronic stress will bring you chronic diseases, including rheumatoid arthritis, on the surface.
Absolutely. And even I have created a framework to help my patient understand. I call it NESS, N-E-S-S. So nutrition, exercise, sleep, and stress management. So those are some of the modifiable risk factor to minimize your risk of rheumatoid arthritis. And even sometimes example of a loaded gun. So if you have a family history or you have a genetic risk of rheumatoid arthritis, there is a loaded gun. Unless the environment trigger it, you will not get rheumatoid arthritis. So always try to avoid those triggers so that the loaded gun doesn't fire and cause rheumatoid arthritis.
Absolutely. I love that you created this kind of framework.
Because it helps my patient understand and remember better, right? So that we can be more effective on communicating the message to our audience and my patients too. Now, the next, we talk about what are the symptoms. Now, if I have those joint pain symptoms, what do my audience who is listening to us, if they have any joint pain, if they have a family history of rheumatoid arthritis, and they have some other risk factors, so what should they do if they have any joint pain?
I think they should start the conversation with their primary care physician. And if they don't get an answer, they should ask for an evaluation with a rheumatologist like us. I mean, you and me, we deal with joint pain every single day, and we were trained to specifically look at the joint pain in a different way than the primary care physician looks. I mean, they can definitely start the workup, and I would encourage the primary care physicians to start the workup for rheumatoid arthritis. But just because the labs are negative, they shouldn't disregard the symptoms of the patient, because as you know, as I know, 20% of cases of rheumatoid arthritis are seronegative, which means that nothing in the lab work, not even the markers of inflammation are elevated, but the patients will still have the disease. So just because your labs are normal, don't feel like you are dismissed. Just pursue, be your own advocate, and get to see a rheumatologist who will be, most likely in the position to evaluate that joint pain further.
Yeah, absolutely. So I think your point of being your own advocate is as important, right? Because as you know, many of the time the doctor's appointment are short. You may not be able to tell everything. And interesting enough, many of the time when you see the doctor, your joint may not be inflamed. So the doctor is trying to help you, but they may not find those changes. And the lab also do fluctuate with time. So it's not always abnormal. So being your own advocate and then telling your doctor your story, that will help us get the diagnosis early. Now, Dr. Girnita, we are almost coming to the close of our session. It was very nice talking with you. I learned a lot from you, and then I'm hoping all of my audience also learn a lot about rheumatoid arthritis. Tell us a little more about your practice, how they can reach out to to you? If they want to visit your practice online, how they can do that?
So my practice is called rheumatologist.call.com, and that's the website, but the practice is called Rheumatologist on Call. We have a telemedicine practice primarily. We also have an office. I would see patients twice a week in the office, but we want to serve as many states as possible. We started with 3 states. Now we are in 15 states, covering 15 states in the United States. If they go on the website, once again, rheumatologistonCall.com, they will find the information where we cover patients. And in this way, my belief was from the very beginning that we as physicians, you and me, should never limit our knowledge to the 4 walls of our office. And that gives patients that otherwise could not be seen for many months, because in rheumatology, we are so few rheumatologists, and the waiting time is between 4 and 6 months to see a rheumatologist. So what should you expect a patient that is in pain to do? Wait for 4 months or 6 months to see one of us? So we gave patients the opportunity to see us. I have seen patients, I'm located in California, by the way, but I have seen patients in Ohio, Florida, Texas, you name it, Oregon, Arizona. Those patients never had to travel to see me in person, but they got the treatment. They got the diagnosis first, they got the treatment, they got the follow-ups, all done from the comfort of their home. And I believe that by breaking these geographical barriers, we as doctors, we are able to help more patients in a faster way when they need it the most.
Mm-hmm. Yeah, absolutely. Learning from you, and one of the main reasons why I got into social media, this YouTube channel, all this is making that impact, right? As you mentioned, we can impact our patient locally, seeing those patients in the clinic, but the way we can educate the patient, it has a much bigger impact in the whole world. So that's why this is my passion, is to make a bigger impact to all the patients who are living with rheumatoid arthritis, not just here in the US, around the world. There's a lot of limitation on when they can see a rheumatologist, or even they can see a rheumatologist or not. I'm personally from Nepal, and there's a lot of difficulty getting to rheumatologists. So my hope, your hope, is to create this community where we can share information so that they can get the right resources. They can get the right information to help them feel better, even with the lack of resources. And as
I'm sorry to interrupt you. I am glad that you said that, because there are many countries in the world that don't have access to specialized care like we have here in the United States. We are very fortunate here. Our patients are fortunate here. Yes, they can see us in 4 or 6 months, but they still get to a specialist that is trained to diagnose and give you options. And what I see from other countries, and I can tell you from, countries that you would expect that they have great medical care. I'll give you an example. I have had patients from France, from Germany, from UK, from Romania as well, reaching out to me from India. I had patients from Abu Dhabi, I had patients from all over the world reaching out to talk to me about, is this the right diagnosis? Is this the right treatment? What are my other options? Because locally, they don't find people to be qualified. Although they would have had access to medication, those people, because they don't have the training, or I don't know exactly what's happening, or whatever limitations are in that system, they will keep the patient on Plaquenil for 10 years and they will not give them methotrexate, or they will keep the patients on methotrexate for many years and they will not switch it to a biologic. And the patients will suffer, and what they need to know is that, what are my options? And when they got the information, I can tell you that they follow up with me and they said, hey, I went to see my rheumatologist here locally and I said about this medication, and they started me on that, and I feel so much better. So our impact could be really global if we take that information that we have and we share it with them. And people, of course, it's important to get to one of us to talk one-on-one, because whatever we put on social media might not apply to everyone. So that's why you have to have one-on-one discussions to get to the right information for your case.
Absolutely. So as we discussed, every treatment plan has to be personalized. So that's why you definitely need to see your rheumatologist. If you have an option to see rheumatologist, so that you can make a treatment plan that is tailored to you. But kudos to your team that is helping improve the access to rheumatology, even in here in the US where there is so much need and there's limited number of rheumatologists. So thank you so much for all you do on your social media, on your practice locally and then online. And thank you so much for all your time and educating us about rheumatoid arthritis. And I'm hoping all of our audience who are listening to this have learned about rheumatoid arthritis. And then please like, subscribe, and share all of the information we are putting out in the social media so that a lot more people can view this quality information that we are providing. Thank you so much for your time. Take care. Bye-bye.
Thank you.